On June 7th, Stop the Chamber was part of a protest at the U.S. Chamber of Commerce headquarters in Washington, D.C. The event was held by National Nurses United Union and Progressive Democrats of America. Thousands of nurses rallied in front of the White House and then marched to the steps of the U.S. Chamber of Commerce building to protest against the U.S. Chamber's use of tens of millions of dollars in Wall Street money to subvert our democracy and its support of policies that harm American workers and the middle class.
I'm talking to Stephen Spitz from
Falls Church, Virginia.
From Falls Church, Virginia. And what organization do you represent?
Progressive Democrats of America.
Okay, and why are you here today?
Well, I am here today because I am among the nurses who are protesting the role of corporations in our healthcare system. And I personally am involved with the Chamber of Commerce is a very good place for us to be demonstrating in front of, because I am the new co-chair of a new initiative that PDA is launching this month called the Campaign to End Corporate Rule. What we have in this country is the corporations have hijacked our democracy. What they've done is leverage their wealth and their power into more wealth and power so that, for example, in healthcare, one easy way to save Medicare, according to Joe Stiglitz, the Nobel Prize-winning economist, would save $1 trillion over 10 years, is to eliminate the price-fixing scheme the drug companies put into place under the Medicare Part D prescription drug program, which bans the government from negotiating drug prices with the drug companies.
And a lot of those drug companies are represented by the Chamber of Commerce, right?
Exactly. So what they do is they funnel their money from their profits, from their price-fixing schemes, the drug companies and all the rest of them, they funnel them through the Chamber of Commerce, and they wind up in these secret campaign contributions or expenditures for campaigns to defeat people who don't, who they feel aren't as strong supporters of what they want. And
Activists handed in demands like pension contribution increases and mortgage payments to Goldman and Sachs, representing corporate America on the steps. They called on a fair tax system where Wall Street and corporate America pay their fair share, and to use those funds to pay for programs like Medicare and Medicaid. To join our campaign, please visit StopTheChamber.com.
Main Street and NNU have no better ally in the U.S. Senate than Barbara Boxer. Thank you. Anybody here from California? I'm loving you a lot. So listen. They're coming after Medicare, and we say, no way, no way. What do we say? No way. I think they need to hear it all the way over there. Eric Cantor needs to hear it. That was good. I'm so very happy to join you today again. I was here recently for another wonderful rally, because it gives me a chance to thank all of you, not only for helping me to keep my work, so I can fight for those patients that you serve, but also for what you do on the front lines every single day. You're there for all of us when we need you, when we're in pain, when we're in need. You show your dedication and your compassion. You show your heart every single day. Too often, the work that you do is between you and your patient, and it may be overlooked. Too often, your concerns may not be addressed. And too often, far too often, nurses are overworked because of staffing levels that are simply inadequate. And I'm here to tell you that is unacceptable. It is unacceptable. That's why I'm so excited to work with you again to reintroduce the National Nursing Shortage Reform and Patient Advocacy Act. This bill protects the rights of nurses, first of all, to speak out for your patients, to speak out for yourselves, without the fear of retaliation, because if there's a problem at your hospital, you should be able to talk about it. That's the way we make things better in America. Not by silence, by honest talk. And this bill sets a minimum nurse-to-patient ratio, because patients are not going to get the care they need if you have too many to take care of. And 12 years ago, nurses in California fought and won a major battle for their patients and for themselves, and they won minimum nurse-to-patient ratios. And we now have proof, scientific proof, that it is working. And I love nurses. You're not afraid of anything. You weren't even afraid of the Terminator. He terminated himself. Research found that if other states adopted the same minimum standards, they could decrease surgical deaths in hospitals by more than 10%. So this bill is a lifesaver. We can say our bill to reduce those ratios is a lifesaver. Studies show that our patients in California are more satisfied. They feel the quality of their care is better when nursing staffing is better. Let's face it, the patients don't see the doctors all that often. It's in, it's out. It's the nurses that carry out the needs of the patient. It's the nurses that are there when they cry in pain. It's the nurses that respond to their families. So I'm committed to bringing those ratios to the rest of the nation. And if people will listen, they'll see what a win-win-win this really is. So I'm going to enlist you not only on this bill, but that fight to save Medicare and Medicaid. Because I'll tell you, my mother always said, all of our mothers always said, without your health, you don't have a thing. I don't care if you're a poor person in the street or the richest billionaire in the corporate suite. If you don't have your health, you don't have anything. And you're the ones who bring people their health back. You're the ones who ease the pain when we need you. So you know better than anyone. When we say Medicare has to stay, when we say Medicaid has to remain, you know what happens in nursing homes if we cut Medicaid. What's going to happen to the most vulnerable, just fragile people in our society? Terrible, terrible things will happen. Somebody said they'll die. They will die, but they'll suffer. They'll suffer badly, and they'll leave this world thinking no one cared about them. Well, we're here to say this. We're sending a message to the families of America. The nurses care about you. There are members of the Senate and Congress who care about you, and we're going to work together. Thank you so much. Keep up your wonderful work for the people. California, thanks for sending me back.
We have a button for you. We're on a quest for the Main Street campaign, a contract for the American people, and we are proud to present you with that button to let you know we're going to be asking you to join our fight.
Well, let me say this. The Republicans once had a contract for America, but I thought it was a contract on America. I'm ready for a good contract, and this is it. Thank you very much.